Kidney stones are nothing but the salt deposit in the collecting system of the kidney. As we know that kidney has mainly two parts. One is the filter, what is called the structural and functional unit of the kidney, also called as the nephron, and the other part includes the blood vessels and the connecting tissue. So inside the nephron, the blood gets filtered and the urine is formed. In the urine, the major portion is water and the minor portion is salt. So when the salt concentration is beyond the capacity of the water to hold it in the dissolved form, it gets precipitated and the crystals get deposited in the collecting system of the kidney to form what we call as kidney stones. So to know the prevalence rate of kidney stone, we need to understand two terms. One is annual prevalence rate and the other one is lifetime prevalence rate. So suppose in an area which has about 1000 people, in them if we do serial scans and we find that in 1 year 100 people have kidney stones, then the annual prevalence rate would be 100 by 1000, which is 10%. In the same population, if we follow them with scans throughout their life and if we see that how many of them form kidney stones, let's say the number is around 200. Then we say that the lifetime prevalence rate is 200 by 1000, which is 20%. So, the annual prevalence rate of kidney stone in India is about 5% and the lifetime prevalence rate is about 10 to 15%. It varies from area to area. Kidney stones are broadly classified into two types, calcium containing stones and non-calcium containing stones. Most of the kidney stones, that is the majority, about 80 to 90% of them, they contain calcium. And it is of two types, calcium oxalate or calcium phosphate. Calcium oxalate can also be classified into calcium oxalate monohydrate or dihydrate. Non-calcium containing stones include struvite stone, cysteine stone, uric acid stone and other rare form of stone which are formed mainly from drugs.